Indigenous people have a long history with colonization. Part of it is because of centuries of being misrepresented by what we say, what we do, and the judgments that other people have placed on us. And it's really made it difficult because, things like the doctrine of discovery, we had no idea what that was. But yeah, here was a piece of paper telling other people they have the right to come and do the things that they did to us. Didn't really matter what we had to say about it.
A lot of our languages and our cultures have gone to sleep as a direct result of colonization, and so we have this next generation of children and families who are coming up in the world who need to have that access to our languages and our cultures, because our culture will help us heal from historical trauma and the trauma that the pandemic has caused.
We had lost so many people to infections, disease, and rather than that being seen as a tragic episode of sickness, it was seen as divine intervention or some kind of will of God and things like that. So in a lot of ways, we really have been conditioned not to trust how we are spoken about and how people see us, because it's so hard to know what they see until after they go off and they tell other people about us. Even today, the representation is still really not accurate.
Colonization makes much of how we understand and interpret stories about our past difficult to untangle from the colonizers' gaze, because they wrote the books, told their stories, and built the infrastructure that we are forced to operate within. It's how we were socialized. Part of decolonizing data is stripping away and giving back what is not ours, instead reclaiming and refocusing how we tell our stories. When we tell our stories, we engage in an act of survivance. It is our culture, and culture is what will heal us from the health disparities we experience under colonization.
Disparity is driven by factors that are outside of the individual or community level influence.
So we experience disproportionately high rates of COVID-19 infections, for example, and we weren't seeing the patterns that were emerging, and those patterns are important because it's an opportunity for us to be able to serve our community in a better way.
Disparities help us to identify differences in health impacts, health outcomes across populations. In general, within a Western framework, we're using white populations as the referent category, and so the comparison is always being made to white populations. If you look at a bar chart, it's the difference between the bars that's actually the disparity.
These disparities are the lasting impacts of colonization. Part of the process of decolonizing, connecting back to land and culture, also includes reclaiming sovereignty over our stories. This way, we not only have control over how data projects are developed, how data is collected, and how it is disseminated, but also oversee where it lives and who has access to it.
Data sovereignty is our ability to tell our own story, and when you look at communities that have high health disparities in a number of areas, you can't tell that story without telling the story of colonization and having those side by side. You can't tease them apart. And when we have control over the narrative, the truth is told.
When we think about data justice and data sovereignty, these are practices and ideologies and ideas and tools that have really been led by populations who are historically and continue to be oppressed, who continue to experience racism and the lasting impacts of colonization within the systems like public health that are effectively designed to support us and take care of us, safeguard us, but are actually not well prepared to do that.
When we have control over the stories and who we're sharing them to, and when we have a say in how we're taking those stories and putting them together to create this beautiful picture, that helps all of us be uplifted. That helps all of us to become whole, and so that we can continue the teachings that those stories give to us about being these beautiful blessings on this earth.
Without data, without accurate information, and without accurate data on our people, we're invisible. And we operate in a world, in a society where that information is really the only way that you can seek funding, and that funding is often controlled by governments. And when you think about what they want to fund, and if our data is not reflective of our true numbers and our true identities, then it's an act of erasure, of continued erasure within governmental systems.
You should care about data because where the numbers are where the money goes.
It is our duty to make sure that we're getting these accurate numbers so that we can serve our people in the best way possible.
Our stories are who we are. The data we see that goes into spreadsheets or on data dashboards can be intimidating, boring, or even frustrating. But when we work towards Indigenous data justice, we can change how that information is presented, where that information goes, and who it impacts. Data is our record of how we exist in the context of our world, and it includes the understanding that we, the ones who live these stories, are the best ones to tell and protect them.
Part of why I wanted to be part of social justice work was because I live these statistics that people talk about all the time. I mean, we hear about what the Indigenous people go through, the statistics of poverty and homelessness and broken families and blended families. Our murdered and missing Indigenous people, our two-spirited people, our environmental problems. I live a lot of that. Even in my hometown where I was living at, we had arsenic contamination in our water, which a lot of people don't know about. And part of the reason why I wanted to be in these rooms and, at these tables was because we weren't really being represented.